Hey everyone, welcome to the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is the president of Hinge Health, Jim Pursley. Jim, how's it going?
I'm doing well, Jared. Thank you for having me today. It's great to be here.
It's great to have you. I'm excited to dive right in. We have really three core things I wanted to chat with you here today. And I told you we keep these typically short and sweet, around 15 minutes. So let's dig right in. So
Great.
First question for you is, major impacts of digital health on rural and underserved populations. What do those major impacts look like?
Sure. Well, you think about rural and underserved populations, there's a couple of challenges that we think about here at Hinge Health, and I think just exist independent of Hinge Health. Affordability, availability, and access. And there's a lot of friction. There's a lot of friction for all of us, but especially in rural and underserved populations. And I think digital health is well positioned, maybe uniquely positioned, to address those three pillars. So affordability, availability, and access. And so I think that when we look through that lens around how do we remove friction, whether it's the cost of care, whether it's just a shortage, you think about women's pelvic health and the availability of pelvic health therapists who are trained in women's pelvic health. There's just a significant shortage, not just in rural areas, by the way, but especially in rural areas. And then just availability and, how do I get there? Whether it's transportation issues, whether it's inconvenience, whether it's having to find childcare and I'm a shift worker and having to take off and find somebody to watch the kids while I go get physical therapy. Digital health is, I think, uniquely positioned to address those, giving more access and more affordable care to people in underserved populations and rural populations. So it's a meaningful part of the strategy to address that gap.
What is something that leadership within, whether it be health systems, what are typical leaders missing when it comes to this space? Yeah,
this is something that we talk a lot about. Historically, I've noticed that both sides of the divide, I'm talking about the digital and analog divide, the traditional healthcare and the new digital healthcare tend to be fairly dismissive of the other. So healthcare leadership, a health system, a health plan, people need in-person care. We have the scale, we have the sophistication, we have the tools. Digital health is a novelty. We are the center of gravity. They're kind of dismissive in some ways. But digital health is also dismissive, especially, I'm here in our headquarters in San Francisco, and the tech universe can be dismissive of traditional healthcare. Like, how hard could it be? We digitized retail and commerce and banking, and we can digitize healthcare, and we're going to blow the whole thing up. And that's not the answer either. So I think really capable leaders are the individuals on both sides of the divide that understand that the home run is the elegant integration of the digital and the physical, the traditional and the digital. And if we can use digital, kind of a digital forward approach to improve things like access, affordability, availability, while integrating in an elegant way into the traditional system to provide a better member experience, to provide better care coordination and collaboration. If we can do that and leverage, because both play a really important role. And to the extent that we can leverage those, I think we're going to create better member experience, drive better outcomes, and lower costs, which is what we all profess to want to do, is that triple aim of cost, quality, and access. So I think that, from a leadership perspective, that's the job of leaders, regardless of whether you're at a health plan, a health system, or a digital health company, is to say, I need the other people in that ecosystem, and I need to find a way to work better with them and collaborate better with them. So that'd be my encouragement to leadership.
It's always nice when it's a similar thing for leaders across various areas of healthcare. That does not often happen, right? Where the advice is very similar for everyone involved.
Yeah.
We usually have to kind of change everyone's view on exactly what they should be doing. I want to shift focus a little bit, Jim, to everyone's favorite topic now. If you don't bring it up in a podcast episode, what are you doing? And it's really, around this area of the current and future role of AI in healthcare. Would love to hear kind of your point of view on this topic.
Yeah. So like most industries, we believe that AI is going to impact and ultimately probably revolutionize the way we deliver care. So the first thing is, I think, it's helpful to think about where's AI play a role? We talked about this elegant integration of the physical and the digital. We'll take a step back. At Hinge Health, we think about kind of this elegant integration of software, hardware, and people. Each one of them plays an important role. So software is obviously where AI is going to have the biggest impact. So using, in our example at Hinge Health, we use AI, computer vision specifically, and machine learning to augment an in-person physical therapy experience with nothing more than the camera on your smartphone to deliver a rich, highly engaging experience for members in a way that allows them to do it from the convenience of their home or from their hotel or from their place of work. And so AI is going to continue to impact, I think, the software side. On the hardware side, we believe very much in the importance of hardware, whether it's advanced imaging in the form of, MR and CT. Here at Hinge, we've developed something I have here in my hand called ENSO. It's a non-addictive, non-invasive, high-frequency pain stimulation device, FDA cleared. And we just launched our third version of this, third generation of ENSO, allowing customized waveforms to treat pain, specific body parts, specific causes for members maybe who are in too much pain to start physical therapy or need a little extra support. And we can talk more about that. And then people are really, really important, and AI is not going to change that. That's my belief. People are, we can debate that on a future podcast. But we believe in the value of a complete care team. So board certified health coaches, doctors of physical therapy, orthopedic surgeons coming around our members to provide complete and comprehensive care. Having said that, we do think AI can make our people even more powerful. I kind of compare it to the Iron Man suit, in the sense of the individual inside is a human being, but the suit gives them superpowers. So think about AI. We get a lot of unstructured data, lots and lots of unstructured data in all of our physical therapy interactions and coaching sessions. AI can help us to aggregate that unstructured data, synthesize it into actionable insights, and serve that up to our physical therapists in a matter of seconds, which previously would take hours and hours for a PT to go through all the notes. So AI is going to transform software. It already is, again, in the form of computer vision and machine learning. We got the hardware piece, and then we got the people piece. And our approach is to use AI to empower them, not to replace them. So how do we give them kind of that Iron Man suit versus replacing people, which we think are really important.
I love that. Yeah, it's interesting, right? There's always these side conversations about how AI is going to replace all these jobs, and will there be some jobs that get replaced, in healthcare and beyond? Of course, right? But those jobs at some point we're going to get. It's not that they wouldn't have been replaced if AI wasn't a thing. What was going to happen is we were going to move it on to someone else's workload at some point anyhow, right? So now we're able to be much more efficient, which with I'll give you an example too. Because I love what you were saying. I recently interviewed general partner of NFX Ventures, James Currier, and he was saying what AI really allows us to do is it allows us to rethink of all these different processes. Like previously, your standard interface, right, would be maybe a dashboard and things like that. Now, over time, that could end up changing. It could literally be a chat conversation, or you could interact with your email and have the same effect as having this full-scale platform. So I think it's interesting on how things are changing and how it's truly augmenting humans to just be their best selves. Like you said, the Iron Man suit. I do want to caution though, and this is something I wanted to ask you, why technology alone can't transform our healthcare system? Why is that?
Yeah. Healthcare at its core is a deeply human experience. It's about longevity, living our best life, getting the opportunity to accomplish and achieve the things that we're passionate about, whether it's as a husband, a father, a CEO, whatever. For me, I have to have my health if I'm going to get through all those things. And so there's something deeply human about it. And I think if we remove the humanity from healthcare, one, I don't think it's going to be as effective, and two, I don't think we're going to see the outcomes. There may be a cost play there, but I think there's something deeply human about healthcare. With that said, there's lots of, again, kind of low value, repetitive task, whether it's documentation in an electronic health record, whether it's doing notes from a PT session, that we can automate and we can augment using AI. But this idea that one of the deep desires of us is to know and to be known. And I don't think AI will satisfy that deep desire in replace of humans anytime soon. But how you interact with people, the frequency, the types of interactions you have, the cost of those interactions, I do think AI can play a really powerful role. And we're already seeing that in our business in the way we're deploying it today in very positive ways. But I'll go on record, Jared, on this podcast saying I don't think AI should or will replace people in healthcare.
Yeah, I mean, it is crazy to me though to see where we were at with AI last year versus even now, 12 months later. So I think you're 100% right, but the conversation will continue to get stronger in one way or the other as each month goes on, as the technology continues to progress, right? I do think people need to steer away from. We have a lot of people that are like, I'm not integrating it at all. I'm not going to do that. Like, I caution, throw caution at those people, because I don't think that's the strategy either. I think it's like you were saying, is to approach it strategically, figure out what the best use case is it for your business.
What allows us to run the best business we can. If we're going to have orthopedic surgeons on staff that are going to engage with our members to provide an orthopedic consult or a second opinion, I'd rather invest dollars there than in kind of a lower value, maybe more repetitive task that somebody else had to do that we could automate via AI. And it's not about AI versus people. It's about where can AI improve our cost structure so that we can reinvest, whether it's in R&D, whether it's in innovation again around hardware, or whether it's in other people. And the example I use with orthopedic surgeons, but it's really it's about how do we reallocate and reinvest, not replace wholesale. I think that's kind of how we think about it here at Hinge Health.
Yeah, and I want to get away from, how a big complaint with AI is like it could present like a lot of, in some cases, false positives when it comes to certain tests and things like that. Like, I hear people throw the complaints about that. Like, wouldn't you want to know, like, if there was an issue though? Like, even if it turns out it wasn't true, wouldn't you like to be more cautious though, to know that something might have happened? And even if you have to get a second look at that point, like, I hear a lot of complaints when it comes to AI of, well, it can develop false positives, or even when we talk about the scan technology, right? Like, it can create false positives, but I personally would rather have a false positive and then get a second opinion, or use that information to help, like, with whatever with your hardware or whatever else you're releasing. It's a little annoying when people, the only thing they can come up with was it could have a false positive, it could be wrong. It's like, a person can still be wrong. I don't know. What are your thoughts on that?
Yeah, well, I think there's probably a lot of people that feel the same way as you do. I do think accuracy is important. We should continue to invest and push for accuracy. If we're going to deliver affordable healthcare, we want to give people the right information at the right time when they can act upon it in the most accurate way. So I do think we should keep challenging, but that's a challenge that we should keep working on solving, not a roadblock to implementing innovation. And so, to your point, I don't think that's a valid reason not to continue to invest and continue to kind of push forward on how we can use AI to innovate there. But we should hold ourselves to a very high standard of accuracy. I don't think there's not enough people and not enough dollars. If you look at a percentage of GDP, there's not enough dollars in that we can just throw at a lot of false positives and unnecessary healthcare spend. And so I agree with you in one regard, but I also think that we should, as an industry, hold ourselves accountable to a high standard of accuracy.
Yeah, I mean, at some point, too many false positives is just we're already spending enough, right?
Yeah, when you have the whole like boy who cried wolf syndrome, and then it becomes white noise, and then we start to tune it out. So I do think there is a valid desire for accuracy.
As we wrap up here, Jim, what's next for Hinge Health that you don't mind sharing with us today that you're excited about?
Yeah, no, thank you for asking. So again, we're going to continue to innovate on a couple of fronts. One on what we just talked about, which is the AI front, where we've developed and brought to market sophisticated computer vision technology that allows us to augment the in-person physical therapy experience using the smartphone that all of us have in our pocket. So it's like having a PT in your pocket. I want to keep innovating there. On the hardware front, we're really excited. Again, one of the things I mentioned about the third generation ENSO, that's also over-the-air updatable. So as we develop new waveforms for new types of pain, new areas of pain for the body, new use cases, we're able to update this. And so we're going to keep innovating with our ENSO technology, because we really believe, as we look at the opioid epidemic, as we look at access to physical therapy and people who have barriers of pain, ENSO is a big part of that. So we're excited about that. And then the integration, like we talked about, Jared, how do we integrate the physical, the digital, the traditional, and the new in ways that deliver a better member experience? And so we're looking at partner integrations. We work with over 50 of the nation's leading health plans and PBMs. 4 out of 5 have chosen Hinge Health to be their partner. That's a big responsibility. They've got a lot of data, they've got a lot of systems, they've got a lot of people, clinicians, and it's our job to work hard every day to integrate better and become a trusted partner and a part of kind of the mature healthcare ecosystem. Not the startup community. So as we evolve beyond a scrappy startup, we want to be a great partner to all those health systems, health plans, PBMs, and ultimately we want to be a great partner to our members to help them move beyond pain. Today, over 18 million adults in the U.S. have access to Hinge, but that's a small fraction of the number of people that have MSK pain. And so we've got a lot of work left to do. And, when we hang up here, I'm going to get back at it.
I love it. Jim, thanks for joining us here today. Looking forward to future conversations, and thank you for all that you and Hinge Health do.
Well, Jared, thank you for taking the time. Stay healthy, and I look forward to talking to you again soon.